Thank you, Speaker. I want to bring to the attention of the House this evening the committed work of the Nepean GP Network Health Consumers Advisory Committee. This committee is doing some work on type 2 diabetes. They have an awareness campaign through its Health Consumers Advisory Committee. They are spearheading this campaign that is designed to address the growing prevalence of this preventable chronic disease in Nepean Blue Mountains region. This initiative aims to educate health consumers, identify individuals at medium and high risk using the AusD risk tool, and encourage proactive engagement with their GP to adopt lifestyle changes that could mitigate their risk of developing type 2 diabetes and management of their overall health. The campaign is structured in two distinct stages to maximise community impact and data collection. Stage 1, community engagement and the pilot program. This initial phase aims to complete 1,000 AusD risk tools with health consumers at community events, including Senior Citizens Week. The focus will be on engaging populations at heightened risk, particularly individuals over 60 years old and those of Asian or First Nations descent, who are statistically more likely to develop type 2 diabetes. The tools and resources used are paper-based AusD risk tools distributed at events with trained and informed members of the Health Consumer Advisory Committee, available to provide guidance and support in completing the tool. It is the intention to identify health consumers at medium to high risk and encourage them to see their GP for further advice and potential lifestyle intervention. The Stage 2 digital expansion and broader reach, it will be building on Stage 1, and the second phase involves developing a tailored version of the tool to enable a scalable, efficient approach to screening that is within the ability of the committee to administer. This stage aims to engage 1% of the Nepean Blue Mountains local health district population, or around about 7,300 individuals. The digital integration is an online tool, and it will collect data and facilitate secure transmission to the health consumer's GP for follow-up care. Expanded target audience is a phase broadening the demographic to include consumers aged 40 and older, incorporating a more comprehensive approach to prevention and management. According to Dr. Pathan Faraz, the Nepean Blue Mountains region faces a significant public health challenge, with obesity rates in 2017 exceeding the state average by more than 10%, compounded by one of Australia's highest childhood obesity rates. And these statistics underscore the community's elevated risk. As I said, it is a preventable condition that, if left unmanaged, can lead to severe complications, including cardiovascular disease, kidney damage and amputations. Currently, management relies on GPs and allied health professionals. However, barriers such as limited access to bulk billing GPs, difficulties in securing timely appointments and lack of continuity in GP-patient relationships does pose additional challenges for those seeking care. This project directly addresses these systemic gaps by proactively identifying at-risk individuals and encouraging early intervention. The Nepean GP Network is the primary supporter, with its board of directors tasking Health Consumer Advisory Committee with implementing Stage 1 as a pilot program to evaluate the campaign's impact and scalability. It aims to empower health consumers with knowledge about their individual risk, encourage re-engagement with primary health care, reduce the long-term prevalence of type 2 diabetes in the region, establish a scalable framework for health campaigns addressing other chronic diseases in the future. This initiative represents a proactive, evidence-based approach to mitigating a pressing health challenge and improving the well-being of the Nepean Blue Mountains community. With support from all levels of government, this campaign has the potential to become a model for health consumer-led preventative health initiatives in other regions. I wholeheartedly support their campaign and wish them well.
I thank